if you are suddenly 40 years old and then your front teeth start crowding up and then someone tells you, oh, you need to get rid of your wisdom teeth.
Yeah.
Never touch your wisdom teeth unless they hurt you or they're causing infections.
Okay.
They do not move the front teeth.
That's what they always tell you, though.
Dr. Mohammed Naji, a Smile Master dentist, entrepreneur, and youth mentor, the doctor behind many celebrities and royal family smiley faces. His goal is to raise awareness about societal issues and to inspire the youth.
Doctor, do I brush my teeth vertically or horizontally?
First thing you do before you give instructions on brushing is evaluate what the patient's teeth look like.
The elephant in the room,
Yeah.
mouthwash.
Anything that you feel is burning you a lot,
You avoid them.
try it. Yeah, tiny bit.
No.
Nobody knows what's the difference. What is Hollywood Smile? What is Veneers? What is this? Hollywood Smile is simply, because people were going to call me and ask me, oh, I want to do that. It works on selective cases. Anyone trying to sell you a lifetime warranty for your veneers, run, okay?
Wow. Dr. Mohammed Naji,
Mr. Omar.
welcome to Zeno Talks.
Thank you very much for having me.
It's an absolute honor to have one of the most famed dentists here on Zeno Talks.
Pleasure is mine. Thank you.
So, Mohammed, just to dive straight in, you know, we already know, like, obviously dentistry is the core of what you do. But tell us about your journey. Like, how did you go into dentistry? Not many people think when they're young, and you know, you ask someone, what do you want to be in the future? They say, you know, pilot, engineer, or I want to do this, or be an astronaut. Not many people say, I want to be a dentist. Yeah. So when did you think and realize, oh, you know what, I want to be a dentist?
Actually, this is one of the most common questions I usually get.
Yeah.
And I have a story behind this. So obviously, just like any other child that did not want to grow up to be a dentist, you know, we all fear that person.
Yeah.
The way it was, so I grew up with my brother, who's also a dentist, Dr. Majd, and he is more of a father figure to me, you know. So all of the remaining siblings got married at an earlier age. We were the only ones left at home, and I kind of witnessed his journey from the start, from the day he started the practice, you know, step by step. Although I was a child then, but I was still around the clinic, just hanging around. Okay. So it kind of grew into me, and I was really a fan of what he achieved from nothing to what he got to today. And I thought, you know what, I really want to carry on with this and make something out of it. But this came at the later stage. I remember before I graduated, I wanted to do media. And I wasn't so sure, like, should I, you know, carry on with the journey that's already established in the family, or do my own thing in media. And I decided to take the broader option. Yeah. So I thought, if I did media, I will never be able to work as a dentist.
So it wasn't pressure from the family? Because as Arabs, we all have pressure to be in that kind of like the science side of things, not in the media side.
To be fair, I never had that.
Okay, so your parents were...
No.
Okay, yeah. They were open to that idea?
No, they were very open because like we're 5 brothers and each of us did like a totally different thing. So we never had that kind of pressure. But for me, I thought, let me go for the broader option, which will open up more doors for me. So I thought if I did media, I can never work as a dentist. But if I did dentistry, I can always work in media. You know, I always have that path in a way, or to kind of blend it in with what I do, just like I'm doing today with social media and everything coming up. So yeah, that's my story in short. Yeah.
That's cool. So, you know, let me ask you this. What are some of the most like common misconceptions about like oral health? Because, you know, it's always confusing, and I'm sure a lot of people will tell you this. So they'll tell you, you know, it's enough to brush your teeth like twice a day. Okay. A lot of people will tell you, no, you have to do it like maybe 5 times a day. Or people will tell you, no, you have to stay
after breakfast.
Exactly. So when, what are some of the biggest misconceptions about oral health?
I don't know. Like a common question I usually get for the past couple of days. I don't know why everyone is asking me, do I brush before or after breakfast?
Interesting.
There isn't right and wrong. For me, I think both. Before breakfast, for your partner after breakfast for you, you know. Just
No, but
just like
actually,
that, you know.
I like that question because, by the way, are you supposed to brush your teeth like after every meal?
I do. A lot
Okay.
of research kind of go like, you know, give it half an hour for the pH to settle in the mouth before brushing the teeth. That's a bit too detailed and technical. You can brush after every meal, 3 times a day is good. So yeah, that's one of the things. Wisdom teeth do not move your front teeth.
Really?
Yes.
That's what they
Sorry.
always tell you, though.
Yeah, no. Wisdom teeth cannot move your front teeth. So if you are suddenly 40 years old and then your front teeth start crowding up and then someone tells you, oh, you need to get rid of your wisdom teeth.
Yeah.
Never touch your wisdom teeth unless they hurt you or they're causing infections.
Okay.
They do not move the front teeth.
Okay.
That's-
And wait, and also you mean like even if you have wisdom teeth, but if they don't hurt you, you don't have to pull them off.
Yeah, don't touch your wisdom teeth unless they are infected or causing infection or they're causing any kind of pain.
Okay. Why are they even called wisdom teeth?
Because they come at a later stage in life, which is 18 to 23, where you're supposed to be wise.
You're supposed to be wise.
You're supposed to be wise by then. I don't know which generation that happened, but yeah. That's why they call them that. Yeah.
Interesting. So, you know, okay, so obviously dentistry and dentists have become some sort of like a fad recently. You know, I mean, like, you know, at the moment you see, there are 2 types of doctors that have, I guess, boomed in the last couple of years. Either they're plastic surgeons or dentists. So what's going on with that? Why?
Because it's visible. Think about it. An excellent brain surgeon, you can never visually see his results. Dentistry and cosmetic, you know, surgeons, you can see the results. It's very easy to market. It's very easy to promote. An excellent heart surgeon cannot show you before and after. Dentists can show you before and after.
Okay.
You know what I mean?
That's okay.
So
that's pretty
they're
easy.
easy to promote, I think. Yeah.
And you've been instrumental in adopting technology to your advantage because I mean social media is one. Mashallah, you've got an awesome following on social media, but also you use 3D printing as well.
Yeah, I mean that's part of the the technical thing. Like we use 3D printing to print the teeth that we actually like the crowns that we.
So what would they do before that? Excuse me, because for me, the only thing I've ever done at a dentist is clean. And every time I tell them, I'm like, look, do I have good teeth?
Keep it that
way. you're fine. You don't have to do anything but cleaning. I'm like, okay, that's good. So what would they do before that then?
Before that was the traditional dentistry done in a lab. So basically, we remember, I don't know if you've seen it, they have a mold where they take impressions of the teeth. You know, that. Yeah. So they take that impression, they send it to the lab, they create a mold and a cast out of that. And then they kind of make a wax up of the tooth that they want to do and then convert that into porcelain or ceramics or whatever. And then they fit it into the patient's mouth. Now we just drill the tooth, take a scan, upload it on a software, and we have a 3D printing machine which converts that 3D scan to an actual crown which we fit into the patient's mouth. So instead of going through like a 3 days, 4 days procedure, it's done in half an hour.
Okay.
Yeah, but it's because people were gonna call me and ask me, oh, I want to do that. It works on selective cases.
So, you know, obviously another thing that became another fad in the teeth industry or whatever is this veneers and like the, I don't know, whatever smile, whatever they call them. Like, so I mean, how dangerous or not dangerous are they, or you know, how is it still a thing? Because this was a thing for, I think, when maybe Kim Kardashian or one of these celebrities started it, but then it kind of like died. All of them now, all right? So tell us a little bit about this.
Okay, very good question. You said veneers or Hollywood smile. Let me tell you something. Nobody knows what's the difference. What is Hollywood smile? What is veneers? There's plenty of brand names coming up nowadays. First of all, let's start with Hollywood smile. What is a Hollywood smile? A Hollywood smile is simply a beautiful or a nice smile that suits the patient's face. It could be his natural teeth. It could be crowns, veneers, with drilling, without drilling, so many things. So a Hollywood smile is a nice smile. Okay,
that's all that it is.
That's all. Okay. Now, how do we achieve that Hollywood smile? It could be, as I said, with your natural teeth, you just get proper cleaning, whitening, braces, get them well aligned. Then you'll have a Hollywood smile, which is Julia Roberts. Julia Roberts has a Hollywood smile without veneers.
100%.
Right?
Yeah, she does.
So that's one example. Now, if you cannot achieve it with one of those for any reason, you can go for veneers. Veneers are basically a thin layer which is applied on the teeth, pretty much just like having contacts, lenses.
Okay.
You know, you apply it on the teeth, it gives you more control over the shape and color. Some of them are done without drilling or with minimal drilling, if your teeth are small in size. Others are done with drilling if your teeth need a bit of adjustment, you know, like you have protruded teeth or one is longer than the other, so they just drill the excess from it and place it on the teeth. And some of them, where if it's medically required, if you did like root canal treatments or you have a lot of infections, then they will drill the entire tooth and place a crown on the tooth. All three of them can achieve a Hollywood smile.
Okay.
So it's just a different technique.
The different technique.
Yeah.
But you know, let me ask you this. Like, for example, I wear transparent contact lens.
Yes.
But I have to, these are dailies. I remove them every day and whatever. Or some people use the normal one that's like a weekly or whatever.
Yeah.
But with these veneers, how do they work? Do they just stay there, and as long as, like, if you brush your teeth, do you have to remove them, then you brush your teeth and then you put them back on, or do they just like stick there?
No, that's called the snap-on. That actually exists. I'm not a big fan. I think wear it in case of emergency on a wedding day, something you just need, you know.
Nice teeth on a wedding. Yeah, for the photos.
You just need it for, that's it. But of course, you cannot sleep with it, eat with it, or anything.
Okay.
Take it off, clean it, and that's it. It's like a grill, you know. No, but for veneers, it is kind of a permanent treatment. So it is stuck on your tooth.
Okay.
Okay. But there is nothing called lifetime. Okay. Anyone trying to sell you a lifetime warranty for your veneers, run. Okay.
Wow.
Because your natural teeth eventually break, rot, whatever, you know, get cavities. So imagine something that's artificial. So I would say to my patients, the average age of any prosthesis you put in your mouth, whether it's veneers or crowns, is between 8 to 12, 15 years. There isn't an exact number. But why do we change it? Not because it gets old or because of anything. It could be an excellent one, but we still need to change it. Because when we build the crown or the veneer, we build it based on the size of the tooth today. With time, I don't know if you're aware, but our teeth do get longer.
They do?
Yes. How is that? Because the gum recedes.
Okay.
You know, the gum keeps receding.
Oh, that's why when you see sometimes older people, their teeth look longer.
You know? So what happens is if you have veneers, 5-10 years later, when the gum recedes, you start seeing underneath the veneer the natural tooth showing. So we remove it and place a new one based on the new length. So that's how we decide the age of the veneer. It's never for a lifetime. Now, how do you maintain that? Of course, you need to take good care of it, just like your natural teeth. Brush 3 times daily. Flossing is very important. You actually need to be more careful than without veneers, you know?
Interesting.
So, yeah.
Doctor, do I brush my teeth vertically or horizontally?
I love your question. You sound like my daily routine.
Because it's always a myth, you know, it's like the chicken or the egg. Which one came first? Which one do I do first? Do I go this way? Do I go this way?
Actually,
everybody will give you a whole bunch of things. Do I use a manual brush? Do I use an automatic one? We just need you to dispel these myths.
The sequence of your questions actually perfect.
Okay, done. Thank you.
And this was not planned. So
literally not planned. This was like done like 2 days ago. And exactly. He said, yes, I'm going to come on the show.
So remember what we said, gum recedes.
Okay.
So your teeth will get longer.
Okay.
Let's think that way. I want to prevent that. So the way to do it is lay your bristles on the gum. Let's say I'm brushing the upper teeth. Lay your bristles on the upper gum and bring it down towards your tooth.
Okay.
Do not go against it. So when you go
vertical,
vertical,
I think I usually go the complete opposite.
You go like up and down, which is very harmful for the gum. So the way we do it is you lay the bristles softly on the gum and you brush down towards the tooth, and downwards opposite. So you lay it on the gum and you brush upwards.
Interesting.
However, as per the book, they say the first thing you do before you give instructions on brushing is evaluate what the patient's teeth look like. If they're good, don't even ask. Tell him, whatever you're doing, just keep doing it.
Interesting. Okay.
Yeah. You only interfere in case, you know, you see like there's lack of oral hygiene or there's, you know, something wrong going on.
Yeah.
But if you have good teeth, they're well maintained, no problems, just keep doing what you're doing.
Okay.
Whatever it is.
That's really good advice, actually. Okay, but then what about the second half of the question? Manual or automatic? Which ones are good? Because now you see there's all this promotion on using the automatic toothbrushes.
Conflicts, man. That's like chocolate or vanilla. Look, a lot of research and academically, they now say automatic. Which, okay, I understand it has more movement and stuff, but my only problem with the automatic brush is that a lot of people cannot handle it properly. So they end up, injuring their gum or so. So if they get well trained and they explain well, like the dentist explains well on how to use it, then you can go for automatic. Otherwise, I personally like the manual because I have better control physically. Like I feel when I'm pressuring the areas I need to, but that's very, subjective. So,
The elephant in the room.
Yeah.
Mouthwash.
Okay. What about it?
Good, bad, or ugly?
Depends on what you're using. The ingredients of that. There are many brands that are aggressive.
The ones that you see usually in the supermarkets, they're all over the mainstream ones.
Yeah, I cannot mention names.
Without mentioning names.
Yeah, but like anything that you feel is burning you a lot,
you avoid them.
Try, tiny bit.
No.
Yeah. Okay. Those are the ones we like because they're very fresh.
I know. You feel like, oh my God, I want to walk around and I want to just do
But then please be careful because sometimes dentists do prescribe chlorhexidine. It's not a brand name, it's just a chemical name. And a lot of patients keep using that. Please do not, because that might stain your teeth permanently. So be careful. If you get any mouthwash prescriptions, just get the duration from the dentist as well. Unless it's a daily use one, then that's fine.
Interesting.
Yeah.
But so mine is that for the teeth. Like, is there any other harmful effect of mouthwash? I mean, why has it recently? I started listening to a lot of reading a lot of reports about how you should avoid mouthwash. Not
exactly avoid. It's just that you need to maintain, we call it the oral flora of the mouth, which is the balance of the pH and the bacteria in the mouth. So we have a standard pH that we shouldn't, go above, way above and way below, and the standard level of bacteria in the mouth, good bacteria, that we need to maintain. Now, a lot of those mouthwash would just clear all that, good or bad, And if you keep doing that, then that might affect the normal balance in the mouth, which leads to easier possibilities to get more cavities, more infections, more sores, stuff like that. So
okay. Yeah. So, doctor, let me ask you this. One of the things that people also I've come across, they've had a certain smell in their breath. I've come across this a couple of times. I cannot remember the name of it for the life of me, but it's like no matter how many times they brush their teeth, they cannot get rid of that smell. What is it called? I think you know what I'm talking about.
Halitosis, yes.
Halitosis?
Halitosis. Tosis, yes.
Halitosis. Yeah. What is that? Why? Where does that come from? And is there a cure for it?
Yes, everything has a cure.
Okay.
But we need to first diagnose it. We need to know where it's coming from. So halitosis could be from food that we just ate, garlic, onions, and that's simple to treat, we all know. It could be from cavities in the mouth. So if you have cavities in your teeth, because that cavity is basically a rotten tooth structure. So if you have a lot of those, or if you ignore those and you leave them, obviously they're going to give you that bad smell. Third of all, could be any kinds of infection in the mouth. So sometimes sores, ulcers, any kind of infection might result to that, or diseases. So God forbid, if you have any tumor or something, anything wrong, it's an indication. And please don't freak out. I'm sounding like Google now, Anything you Google, it's a cancer. No. And then we go deeper. It could be the tonsils. It's a lot of people that have tonsillitis. It might cause that. And the final stage would be our stomach. So some patients that have, digestion problems.
So it could come from there.
Could be from the stomach. Or medications. There are certain medications that are very heavy. So you can eat that or swallow it, and you can still feel the taste for like a couple of hours, and the people in front of you would smell it.
Yeah. No, I mean, I've come across some of these people where, like, even if they stood like a little distant from you, it's such a strong, like, pungent smell.
Yeah.
And you'd be like, where in the world is that coming from? You know, like, and why? It's quite. So I mean, have you come across a lot of these kind of patients all the time?
That's what I do for a living.
Wow. Yeah. So what's the cure? How do you usually deal with it?
We diagnose it right.
Okay.
Like we go step by step. So first of all, we make sure he doesn't have any cavities. We treat all the cavities. Problem solved. That's it. If not, then we need to go check the tissue inside, like the cheeks on the inside, any infections, any of that. We'll fix that. If not, then I refer him to gastrointestinal doctor who would do the checkups, and step by step.
How do you deal with people who cannot quit smoking? And then when they come and their teeth are like whatever, like, do you...
By the way, smoking and bad oral hygiene are not connected. You can be a smoker, but you brush well, have chewing gum on you, maintain a good oral hygiene. I'm not encouraging smokers, but you can smoke and still smell nice. We all know that, you know?
Interesting.
So I encourage people to stop smoking for their health, but it doesn't have to do with you being clean or not.
But then when you do see people smoking, you see like either their lips or their gums turn black, or what does that come from?
Pigmentation of the skin isn't like, it's not a must. A lot of smokers would still have normal colors, you know? But some people, the nicotine or the heat itself of the cigarette kind of activates the pigments, and it leads to that discoloration, whether it's in the gum or the lips. Some people have it without even smoking.
Oh yeah. Actually, you're right.
Yeah. Some people, for example, North Africa, mainly like Morocco and those countries, you find a lot of people having a dark gums or lips. Just naturally.
So, you know, obviously, look, there are some people who smoke cigarettes and some people who smoke cigars. And a cigar smoker, sometimes, you know, it's like once in a while or whatever. I know we're not encouraging it, but like, in your opinion, is that an okay thing, smoking a cigar once in a while?
Yeah, I mean, occasionally, you know.
It's fine. It doesn't do like crazy damage to the teeth.
In this department, no. In the rest of the body,
is a different story.
Yeah,
oh, okay.
I'm not gonna just.
Yeah. Okay. So we talked, Mohammed, all through this time now. We're talking about dentistry. I wanted to just dispel all the myths and all the questions, and you know, it's one of those things. I've already asked you before, how do my teeth look? And you said they look great and they're fine, so I'm good.
Yeah.
But minus all of this, what else like sparks your like and triggers your entrepreneurial spirit? Like, what is it about you that makes you interested in like other things? What are you working on now? What are the things that you're actually aspiring to do next? Because I know this could be kind of like a routine as well, but what else are you planning on doing next?
See, dentistry is there, but there's this one thing that I'm just born with is, I don't know what it is, but it always tells me it's not enough. And as draining and as bad as it could be sometimes, you know, beating yourself up constantly with that, sometimes you just stop there and go like, you know, this turned out well. So why not? So it's just that thing. I mean, dentistry is a given. It's something that's running. And, you know, I'm just kind of always looking for something else, you know, like, let's explore this. I've heard about this idea, this business. I have friends investing in something. Let's get on board. So I'm always trying things out. What am I doing now? So real estate is always happening because of, you know, also family as well. And apart from that, I'm working on a new project now, kind of dental related. Okay. Yeah. But I can't announce.
You can't just well, I know you. Okay, you can't announce, but I'll tell you this. The reason I asked you this is because, especially in dentistry, I think when you know, previously I used to have a show. It was about futurism, and I talked about futurism even in the healthcare space, and it's particularly in the healthcare sector. You have a lot of things to do with both AI and robotics that would, you know, impact this business.
Sure.
Do you see a time when, you know, robots will completely take over the dentist's role? Is it possible? Because I've seen that already with like LASIK. Like now you don't even see a doctor anymore. You go in and the whole procedures done by robots. Could a robot take over a dentist role?
Yes, and very soon,
Oh,
but
wow.
not completely.
Okay.
Yeah, like you'll still need a technician there.
Yeah.
Let's call him. Yeah, but yeah, it could happen easily. It could happen, but I don't think it's gonna replace a dentist entirely. There's like we still have that human factor that might be difficult, you know, but with everything going on, I think eventually they will reach there.
Yeah.
Yeah.
You know, one of the things I was going to say is sometimes I read this report that, for example, barbers are seen also as almost like therapists when you go to a barber, because they open up, they talk and everything else. And I think pretty much it's the same as, you know, like when you visit a dentist, because it's probably one of the most personable professions, and you're very close to the patient, and the patient's like literally there giving you all their trusts. It happens, I think, with all doctors, but this one is you're literally staring at them, you're looking at them in their eyes, but for the most part, if they're not on anesthesia or something, you know. So do you feel your role at understanding your patients goes beyond just looking and giving them a diagnosis on their teeth?
I think that is the most important factor that they do not teach in universities, unfortunately.
Really?
I recently gave a lecture in NSU in Miami.
Okay.
And the organizer spoke to me. He's like, so, well, you know, what kind of braces or veneers are you going to talk about? I was like, you're not going to see a single picture of teeth in my lecture. I spoke for it was supposed to be for an hour and a half, and we spoke for almost 4 hours. From how, you know, interactive the lecture ended up being, because communication skills and building emotional trust could take you up there in dentistry, and a lot of people are just not aware of that.
Wow.
You know, like I always whenever I lecture, I always tell the students, you need to speak the patient's language, you know, not his actual lingual language, but you know, get into his comfort zone. You know, it's your job there. And that's what I do. Like for me, the first 15-20 minutes of an appointment is just, you know, chatting with the patient, you know, seeing what's his vibe. Is it about the jokes? Is he very serious? Is he religious? Is he like politics? Whatever it is, it's his, like he's getting into the safe zone. And, you know, it's at this point, it's his word and we're just visiting. So we need to see what makes him comfortable, break that barrier professionally, and then you can get into teeth. And I've seen it, man. Like some people, sometimes it's not even my specialty. Like he needs an extraction of a wisdom tooth. I don't do that. We have a specialist for that. And like, no, doctor, look. I actually had a patient once do that. She's like, no, look, I worked with you and stuff. I want you to do it. I was like, look, I'll probably paralyze your tooth, your face if I do that. I'm gonna hurt you. Like no. I trust you. You're gonna do the right thing, dear. It's not my thing. We have an expert that does that. So after long negotiations, she's like, okay, you know what? Give me the injection. Here, remove the tooth. I was like, fair. Let's do that.
Okay,
you know?
There's some compromise.
So sometimes I do believe it's not sometimes, always. It is very important to have the communication skills, the body language, the tone that, you know, establishes this connection between you and the patient. And after that, whatever you do, it's magic.
No, 100%, because I think especially now the topic of mental health keeps coming up a lot, and I think understanding the mental health of your patients and everything could maybe even help you with your diagnosis of even their teeth condition. Because correct me if I'm wrong, doctor, I've heard a couple of times that I guess if you are like stressed or depressed or something like that, it can affect the oral health, right?
Yeah.
It does, doesn't it?
The human body is, there was a very interesting subject which we studied in university. It was called integrated biological sciences. So there's a link between your hair and your toe. There is a link between your vision and your stomach. There is a link between your acoustic abilities and your arm. Subhanallah, we're connected in every way. So mental health is a major factor which has been ignored for a very long time.
Okay.
And yes, it does affect a lot of things in the body, including the oral cavity or the mouth. One of the common things is aphthous ulcer. So basically the ulcers we get. One of the main factors that cause that is stress.
Oh, wow.
Being stressed out. So that's one of those things. And other indirect factors. So you're very stressed. You keep thinking about a certain problem. You ignore your brushing habits.
Yeah.
You end up having more cavities. So it doesn't have to be directly through through biology, but you know, in a way or another, they all get together. And plus, of course, it's hormones. You know, your hormones change. It affects the saliva flow in your mouth. Leads to a dry mouth. Leads to problems. A lot of things.
Yeah.
So yeah.
You know, doctor, one of the things that they say as well, like you mentioned this a little bit earlier on when it comes to what we eat, right? So I read that, for example, grapes are good for the lungs. You know, the tomatoes are like good for the heart, or you know, what's good for the teeth?
Come on. A day keeps the dentist away.
Oh, okay. The apple. Oh, okay. So the apple are actually good for the teeth?
Apples are good. Yeah, because they brush your teeth off. So when you're biting an apple, it kind of, you know, apart from the actual, you know, ingredients and nutrients in it. Okay. So that's one of those things. For halitosis, green tea, magic.
Really?
Yeah. Green tea is very good for the breath.
Okay.
Yeah.
One of the things I want to know, because I'm obviously a heavy drinker of this particular beverage, is coffee. I you know, some people don't think I'm a real coffee drinker, especially our mutual friend Arian, because he says you drink your coffee with milk. You know, I love my flat white, you know, but I don't drink it black because I feel, well, I like it. I just don't like the acidity too much. Yeah. But also, like, I feel like maybe the milk is a little bit better for my teeth. And also, you get told when you're a kid that, hey, if you drink milk, supposedly the calcium from the milk is also good for your teeth. Is that myth or bust? It's a bust.
It's negotiable.
It's
not exactly, like not throughout your entire life. No.
Okay.
Yeah. Because you don't just like absorb it from the milk directly. Like you have to digest it, and then that calcium.
Oh, yes.
And by the time you're 30, 40, it's not really gonna make a big difference.
It doesn't make its way up there. No. Okay, so that's on the milk. Okay, coffee.
Coffee, it just stains your teeth. That's all. But like, I mean, also tea stains your teeth. Also candies can stain your teeth. Mandi, you know, the orange rice can stain your teeth.
So
everything, it's
you
not
just have to
you know, brush them properly and visit your dentist every 6 months for scaling, and you're good to go. I'm very chill, you know. I'm like the most flexible dentist.
You are. I mean, I know, like, you know, there's others that really scare you and they tell you no and they give you this, but you're like the chillest one, because I mean, and I like this, and I think this is the reason why there's so much love for you.
Thank you.
I feel sometimes you get like a lot of very like aggressive advice, and it just puts you off. And again, then that actually, it does affect your mental health, because you're like, oh, you know what, I can't do this, I cannot do this, because you're always like frightened now between everything.
It's just about being flexible and realistic. Realistic, I think, is key, because it's like going to the gym. You know, when you certain trainers, you train with them. Oh, you have to go 5 times a day. You need to eat 6 meals, and if you miss this one, then you cannot do this exercise. You know, it's not like that. Like, we're not built to do that. It's just about, you know, being everything in moderation, being consistent, and just regular care. That's all.
So, you know, now we're coming to the end of our interview, but I want to ask you, doctor, like, when, you know, how do you see the future of this industry and particularly in this market here? Like, is it growing? Is it staying stable? I mean, maybe I would think it would grow, or it's growing because there's a lot of people moving to the UAE. So you have way more people coming in from all over the world. Probably that's more seats on the table, on your chair.
And we, you know, thankfully we have a lot of dental universities here. Proportionately with the size of the country, there are a lot, you know. Speaking probably over 1,000 graduates every year for a population of 10, 11 million. That's a big number. So, it is growing indeed. Lots of technology is coming up. A lot of people getting into the industry itself. It is saturated. oversaturated. Yes,
Interesting.
but I mean, if you're good enough to prove yourself, if you're willing to put the effort, nothing is going to stop you. Future-wise, I believe technology is going to take over. We will still be needed to organize that and manage this technology. And where, it will still be a major or like one of the main fields required in the human
Well,
health.
100%,
Yeah,
for sure. Where is your clinic right now?
So my clinic is in Jumeirah, Liberty Dental Clinic, Jumeirah 3, right next to Sunset Mall, almost.
Yeah.
And we're located in Abu Dhabi, behind Marina Mall, also, Liberty Dental Clinic. And you can always reach me directly on my Instagram at Dr. Mohammed, that's MMED, Naji, Naji, Dr. Mohammed Naji on Instagram. And you'll find all of my details there, my website, my email. And watch that space. A lot of interesting things are coming up.
Yeah. Any plans for expansion?
Yes. Last thing maybe I can tell you about this project is now we are not expanding by branches because we are very... we're really worried about the quality control.
Of course.
Because it's a family business and we always have to be there. One of us has to be in a branch. So expanding worldwide is a bit tricky because we don't franchise and all that. But what we're doing now is... being the first internationally accredited dental clinic in the Middle East and North Africa, we achieved a certain level of standards. So we built our own guidelines, which was approved, and we are. Thank you very much. And now we are accrediting other clinics worldwide. So we can have the Abu Saidi Dental Clinic by Liberty Medical Group
That's
or Liberty
amazing.
Dental Clinic.
Okay.
So the clinics apply for that. We send them our guidelines manual. They apply that within a year. Then we fly there to evaluate it. And if they are approved or accredited by us, they will follow our guidelines, our labs, our techniques. We train their doctors. They use our media and our website, which means you pretty much have a Liberty next to you somewhere. We have 7 accredited clinics now in Iraq, the States, and Egypt.
Yeah.
I'm flying to the States soon for that as well, Arizona, Texas, and Washington, D.C. So that's how we're expanding. We're accrediting clinics. They follow our guidelines. We monitor that. You'll find more details also on the
Doctor, this is great because especially in the UAE and for the UAE, they wanted to always promote intellectual property coming out of the UAE. Your accreditation is exactly a beautiful example of exactly that. So having to certify and accrediting other clinic. This is a huge achievement for yourself and for the country. I mean, I hope you talk to the Ministry of Economy. They would. This is music to their ears.
Alhamdulillah. Yeah, we actually did, and we just a few weeks ago we had a meeting with the Emirates Accreditation Center under Dubai Dubai government. Brilliant people. Team. They're working on amazing things. So there are some things cooking.
It's brewing. Okay.
And look, I mean, Dubai, man, UAE, it's already a brand. Whatever we're thinking, I'm sure they have a plan for that, But we're very glad, we're very thankful that we were the first to achieve this, and we don't want to keep it there. I mean, we're always proud to carry UAE's name out there. That's what we move with. Stay tuned for more.
Amazing, man. Super proud of you, Mohammed. And all the best with your next endeavors, and looking forward to having you on the show again, or maybe I'll see you at the clinic.
I'm very excited. Yes, I'm waiting for you at the clinic. Thank you for having me. And just to let you guys know, it was very quick. We met 2 days ago. He was like, I want you on the podcast. I was like, yes, sure. He's like, thank you for making it happen. I was like, honestly, a lot of people are doing podcasts, but very few deserve to sit behind the mic. And this gentleman over here is one of those very intellectual people who deserves that.
Habibi,
so thank you for making it happen.
Thank you so much.
Thank you, bro.
Thank you.